You've shared some information about Campylobacteriosis, something that can affect our animal companions, and we know that's something you care deeply about.
Absolutely.
So for this deep dive, we're going to really unpack the essentials of this bacterial infection, drawing from some, detailed veterinary medical resources.
Think of it as getting the core info you need.
Exactly. Our goal is to take that more technical stuff and pull out the most important bits for you.
Yeah, like what Campylobacteriosis actually is, how pets get it, what signs to look for.
How vets figure it out, and critically, what can be done about it.
Precisely. We want to make it clear and practical.
Okay, let's jump right in then. Understanding what we're dealing with. The main player here is a bacterium called Campylobacter jejuni.
That's the one.
Now, it's described as fastidious.
Yeah.
What does that mean exactly in this context? Picky eater?
Sort of, yeah. It means it has very specific growth requirements. Makes it a bit tricky sometimes to grow in the lab.
Okay. And microaerophilic.
Likes just a little bit of oxygen, but not too much. And it's gram-negative, that's a lab-staining thing, and curved in shape.
Got it. But the key thing, maybe surprising, is that it's actually pretty common in the intestines of healthy dogs, cats, other mammals too.
That's right. It can just live there quite happily sometimes.
But it can cause problems.
Yes. Under the right conditions, it can cause what's called superficial erosive enterocolitis. Basically, irritation and inflammation of the gut lining.
So how does an animal pick this up? How does it spread?
Well, the main way is the fecal-oral route. Classic, unfortunately.
Right.
Bacteria are shed in the poop of an infected animal. Then, if that contaminates food, water, fresh meat.
You mentioned poultry and beef specifically.
Yes, those are common sources.
Yeah.
Or even just the environment, surfaces. Another animal then ingests the bacteria accidentally.
Right, so contact with even tiny amounts of contaminated feces. Not a nice thought, but makes sense.
It does.
Once the bacteria get inside, what's their strategy?
They tend to head for these little pockets in the intestinal lining, the crypts.
Okay.
And what's really interesting is their movement. They have this rapid darting motility. They kind of zip around.
Darting motility?
Yeah.
Like little torpedoes.
Kind of. And that movement is actually crucial for them to get established to colonize those crypts.
Huh. And the source material mentions toxins. What do they do?
Yeah, there are a few. There's an enterotoxin, which messes with fluid secretion, causes watery diarrhea, a cytotoxin, which damages cells directly, and something called cytolethal distending toxin CDT, which basically stops cells from dividing.
Wow, sounds nasty.
And there's also invasive. Think of it like a molecular key the bacteria use to get inside the gut lining cells.
They actually invade the tissue.
They can, yes. And that invasion is what leads to some of the more severe signs.
Like?
Well, you might see hematochezia, that's fresh blood in the stool. Also, leukocytes, white blood cells in the feces showing there's inflammation.
Okay.
It can cause ulceration, swelling, edema, congestion in the intestine.
And can it get worse than just gut problems?
In some cases, yes. The bacteria can cross into the bloodstream, that's bacteremia, and rarely it can lead to septicemia, a really serious body-wide infection.
That sounds incredibly serious.
It is.
And even if an animal seems to recover, they can still be spreading it.
That's a crucial point, yes. They can keep shedding the bacteria in their feces for weeks, sometimes even months after they seem better.
Weeks or months. So a seemingly healthy pet could still be infectious.
Exactly, which really highlights why hygiene is so important, especially, if you have multiple pets or bring a new one home.
And this leads to something that really jumped out at me from the source material. A huge number of healthy dogs and cats can carry C. jejuni without any signs at all.
It's surprisingly high, isn't it? Up to 49% of dogs without diarrhea and 45% of clinically normal cats.
Nearly half. That's a lot of silent carriers walking around.
It really is. And it makes things complicated. While younger dogs with diarrhea are more likely to test positive than healthy ones, that link isn't as clear-cut in cats.
Interesting difference.
And another big factor we need to mention is diet. There's a well-established link between Campylobacter and Salmonella too, and feeding raw meat diets.
Especially raw chicken.
Particularly chicken, yes. Studies consistently show much higher shedding rates in pets fed raw meat compared to those on commercial cooked diets. It's a significant risk factor.
Okay, good to know. So thinking about risk, who's most likely to actually get sick?
Well, it seems to be more commonly diagnosed in dogs than cats, though both can get it.
But is there an age factor?
Definitely. The highest risk group is young animals, puppies, and kittens, basically from birth up to about 6 months old. Their immune systems are still developing.
And can it become a long-term thing?
Unfortunately, yes. In some animals, it can lead to chronic, ongoing intestinal issues.
Right, so young animals are the most vulnerable. What signs should people be looking out for?
The number one sign is usually diarrhea, but it can look different.
How so?
It might be kind of mucousy or very watery. Sometimes it has blood in it, or it might be bile streaked. And like we said, it can become chronic.
Okay, variable diarrhea. Anything else?
Tenesmus is common. That's straining, feeling like they need to poop even when maybe they don't.
Right, that urgency.
Exactly. You might also see a mild fever or sometimes no fever at all, loss of appetite, maybe some intermittent vomiting along with the diarrhea. These signs can last, 3 days, maybe up to 15 days or so.
And you mentioned the age difference in severity.
Yes, generally the young ones under 6 months tend to get the most obvious illness, enterocolitis, the diarrhea.
Whereas adults?
Adults are often the asymptomatic carriers we talked about.
Yep.
They have the bacteria, shed the bacteria, but don't necessarily look sick themselves.
Which makes transmission easier, I suppose.
It certainly can.
You mentioned C. jejuni. Are there other Campylobacter species involved?
Yes, C. coli and C. absaliensis are also commonly implicated in pets.
And what other factors make an animal more likely to get sick beyond just age?
Well, environment plays a role. Kennels or shelters with less than ideal sanitation or hygiene, where there's fecal buildup, can be hot spots.
Makes sense. Crowding and hygiene issues.
Right. Also, animals that are already debilitated, maybe immunosuppressed for some reason, or have other parasites.
Like what kind of parasites?
Things like giardia, roundworms, toxicara, or coccidia, like isospora. These can weaken the gut's defenses.
So underlying issues increase risk.
They do. And we should also mention nosocomial infections. Animals can sometimes pick it up while hospitalized for something else.
Oh, right. Hospital acquired.
And for adult animals, sometimes having another gut infection at the same time, maybe salmonella or parvovirus or hookworms, can make them more vulnerable to Campylobacter causing disease.
Okay. So if a vet suspects this, how do they actually confirm it? You said the symptoms overlap with a lot of other things.
That's the challenge. Differential diagnosis is key. Vets have a whole list of things to rule out.
Like,
Other bacterial causes of enterocolitis are high on the list. Salmonella, Yersinia, Clostridium difficile, Clostridium perfringens,
they got other bacteria.
parasites too, worms like whipworms, and protozoa like Giardia and Isospora again.
Viruses.
Definitely. Parvovirus is a big one, though usually much more severe signs, but other viral causes too.
What about non-infectious things?
Absolutely. Did the dog eat something weird from the trash?
Yeah.
Dietary indiscretion, food intolerance, maybe a reaction to a drug or toxin. Even acute pancreatitis can cause vomiting and diarrhea.
That's a lot to sort through.
It is. And in really sick patients, especially with abdominal pain, they might also think about things like intussusception, where the bowel telescopes on itself.
Right.
And for those chronic cases, you have to differentiate it from all sorts of other primary intestinal diseases.
So what tests help narrow it down? Does routine blood work help?
It gives clues. A CBC biochem panel urinalysis, they give a general picture. You might see a high white blood cell count, leukocytosis, especially if the infection is invasive. Biochemistry can show dehydration or electrolyte problems from the diarrhea, but it's not specific for Campylobacter.
So you need to look at the feces directly.
That's where the main diagnosis happens. Finding fecal leukocytes, white blood cells in the poop, suggests inflammation.
Okay.
Then there's fecal culture. You need special transport media, like amines with charcoal or Carrie Blair, and refrigeration, because the bacteria are sensitive. The lab uses special conditions to grow it.
And you mentioned PCR.
Yes, species-specific quantitative PCR, or qPCR. It's very sensitive for detecting the bacterial DNA, even if culture is difficult. It's becoming more common.
Can the vet see anything just by looking under the microscope in the clinic?
Sometimes, yes. A gram stain of watery stool might show those characteristic curved gram-negative rods.
Okay.
And a wet mount, just a fresh smear of feces with saline, can be really helpful. If there's a heavy infection, you might actually see large numbers of bacteria zipping around with that typical darting motility.
Seeing them move like that must be a strong indicator.
It certainly raises suspicion significantly, yeah.
If, unfortunately, an animal doesn't make it, or during surgery, what might be seen pathologically?
Grossly, you might see the colon looking diffusely thickened, maybe congestion, edema fluid swelling. The small intestine might look red, hyperamic, and the nearby lymph nodes, the mesenteric ones, are often enlarged.
Any differences in cats?
There have been reports specifically in cats of the smooth muscle layer of the intestine being thickened in infected animals.
Interesting. Okay, let's move to treatment. What can be done?
It really depends on severity.
Yeah.
Mild cases, especially in otherwise healthy adults, might just need outpatient monitoring. Sometimes it's self-limiting, resolves on its own.
But severe cases, especially the young ones.
They often need inpatient care. Hospitalization allows for isolation, important for preventing spread, plus cage rest, close monitoring.
What about supportive care? That sounds critical.
Absolutely essential. Often they'll withhold food for maybe 24 hours, then start a bland, easy-to-digest diet. Yes, oral electrolyte solutions if dehydration is mild. But if it's moderate to severe, they'll need intravenous, IV, fluids. Sometimes, if protein levels are really low from the gut loss, they might even need a plasma transfusion.
Wow. Anything else for supportive care?
Things like intestinal absorbents or protectants, locally acting stuff might be used too.
And when do antibiotics come into play? Not always needed.
Not always for mild cases in adults, but they're generally recommended if the animal is systemically ill, high fever, significant dehydration, or if the diarrhea is persistent, say, more than a week.
And for vulnerable patients?
Yes, definitely for immunosuppressed patients.
Which antibiotics are typically used?
Erythromycin is often considered the drug of choice.
Okay.
And rofloxacin, a fluoroquinolone, can also be used, but with significant caution.
Why the caution?
Risk of cartilage damage, arthropathy in young growing dogs. And there are dosage restrictions in cats to avoid potential retinal issues. You have to be careful.
Got it. Any others?
Tylosin might be effective. Neomycin is generally thought not to be very effective. And penicillins, ampicillin, usually resistant.
What about those really severe cases? Septicemia.
That requires more aggressive, injectable antibiotics, often a combination, maybe an aminoglycoside like amikacin plus a cephalosporin.
Are there any treatments that should specifically be avoided?
Yes, drugs that stop intestinal motility, antidiarrheals like loperamide, they can actually prolong contact between the bacteria and the gut lining, potentially making things worse.
So don't try to just stop the diarrhea without veterinary advice.
Exactly. And again, the caution with enrofloxacin in young dogs and cats regarding dosage. Always follow the vet's specific plan.
Makes sense. After treatment starts, what's the follow-up?
Monitoring the patient is key, making sure they're improving, symptoms resolving. Your vet might also recommend a repeat fecal culture after the antibiotic course is finished.
To make sure it's gone.
To try and confirm clearance, yes. Though remember, shedding can persist sometimes.
Let's talk prevention. It sounds like something we'd all rather avoid. What are the key prevention steps?
Good hygiene is paramount. Simple, but crucial. Wash your hands thoroughly, especially after handling pets or cleaning up feces.
Okay. Hand washing. What else?
Regular cleaning and disinfection of kennels, runs, food, and water bowls. Basic sanitation makes a big difference.
And the diet factor again.
Yes. The veterinary community generally strongly advises against feeding raw meat diets because of the increased risk of shedding Campylobacter, Salmonella, and other pathogens.
That seems like a clear recommendation based on the risks.
It's a significant risk reduction measure.
So finally, what's the usual outcome? The prognosis?
Well, in adult animals, as we've said, it's often self-limiting. It gets better on its own.
But for the young ones?
For puppies and kittens with severe or persistent enterocolitis, antibiotic treatment is usually needed. But with appropriate veterinary care, supportive fluids, and antibiotics when indicated, the prognosis is generally good. They usually recover well.
Okay, that's reassuring. So let's try to wrap this up. Key takeaways. Campylobacteriosis, it's common. Bacterial, hits young animals hardest, spreads through poop.
Right. Fecal contamination is the big thing. Many animals carry it silently, but it can cause nasty gut issues.
Diagnosis involves fecal tests, looking for the bacteria, maybe PCR. Treatment is supportive care, sometimes antibiotics.
And prevention boils down to good hygiene and, importantly, avoiding those raw meat diets.
Good summary.
So this kind of leaves a final thought for you listening. Given how common this bacteria is, even in apparently healthy pets, what practical steps can you weave into your daily routine, your pet care, to really minimize that risk of transmission in your home, maybe even out in the community? And how might knowing this, especially about the diet link and silent carriers, influence the choices you make about what your pet eats in their overall environment? Something to think about.